Okay. Good afternoon, everyone. Thank you for joining us. We just went and had a very good meeting with many of the interests and individuals who are involved in this current situation that we're dealing with. I want to thank the county executive for his great work and his partnership in this. I'll give you a brief overview of what we discussed, and then I'll turn it over to the county executive for comments, and then we'll take your questions. We got good news and bad news in the state today. We've done a number of coronavirus tests, and the good news was the test that came from Buffalo came back negative. The test that came from Oneida County came back negative. The test that came from Suffolk County came back negative. The husband of the healthcare worker who came back from Iran actually came back negative. So that was surprising to me. The less than good news is we know that we have a Westchester resident, 50-year-old attorney who lives in Westchester, practices law in Manhattan, who had tested positive. It also turns out that his wife has tested positive, his son has tested positive, and the daughter has tested positive, and the neighbor has tested positive. The neighbor drove the attorney to the doctor's office. So they were in a car, it was an enclosed place, and that's probably where the infection began. Once you have a situation like this, then the investigation starts because you're trying to find as many people as you can who might have been come in contact to always try to limit the exposures and contain the exposure. It is an imperfect science, especially when you have a situation like this one where you have a person who may have contacted so many people. But you do the best you can, again, trying to contain. The son, let's start with the 50-year-old attorney, worked in a law firm in Manhattan. We're testing a number of people in that law firm. Some of the tests are pending, but nobody has come back positive yet. The son is 20 years old, is an undergraduate at Yeshiva University, and we discussed that matter at great length, and I'll discuss that in a moment. The daughter is 14 years old and attends the SAR school, and we discussed that matter. The neighbor's children are being tested as we speak to see if the neighbor gave it to his children. What we have decided just now to come up with a protocol going forward, Lawrence Hospital, which is a hospital that the attorney first went to before being recommended to go to the city. The Lawrence Hospital has 8 employees that are currently being tested. The SAR High School will be closed until after Purim, and people who had contact with the individual should be on what we call self-quarantine. Self-quarantine is basically stay in your home, limit the exposure to the number of people that you might come in contact with, and do that through Friday, this Friday. If any symptoms develop, then those individuals should contact a healthcare professional. The synagogue will be closed through March 8th. And those individuals should also be on self-quarantine, depending whether or not something develops that might be revisited, but that is the position now. The SAR Elementary School will be closed through Friday, and those individuals do not have to self-quarantine because it was less of a risk of exposure. Yeshiva University will be closed through this Friday, and we'll be doing gathering some additional information and doing some additional investigation, and then we'll make a decision on Friday about Yeshiva University. So we feel comfortable that that is an intelligent plan going forward. It tries to minimize the imposition on people while protecting public health. And I think that is an intelligent resolution. And again, we will revisit this as you get more information, because we're doing testing all the time. If a test comes back positive, you might modify the plan. If a test comes back negative, you might modify a plan. A little context that we really didn't get a chance to speak to upstairs, but I think is important. We're dealing with a coronavirus epidemic. We have a bigger problem, which is a fear pandemic. And the anxiety here is outpacing the reality of the situation. Now, why do people get frightened in general? People get frightened when one of two things happens. Either I'm not receiving information, or I don't trust the information I'm receiving, or the information is very frightening. In this case, the information is not very frightening. The facts are not very frightening. This is a virus that spreads much like the flu virus. Roughly 80% of the people who get the coronavirus will self-resolve, meaning they'll have it, they'll be walking around with it, they may have some symptoms, but they will self-resolve. 20% may have a medical issue where they have to stay at home, where they may have to be hospitalized, and the people at greatest risk are senior citizens, people with compromised immune systems, or people with an underlying illness. That is our focus. This situation in a nursing home is highly problematic. This situation in a senior citizen center is highly problematic. And if you look at what we've dealt with in New York, it bears it out. The 39-year-old healthcare worker who came from Iran and was tested positive, she never went to a hospital. She's been at home. She's had mild symptoms, and she's getting better. Her husband never even tested positive, and he's getting better. The son and the daughter of the family we're speaking about today, they're at home. None of these people are hospitalized, save one, which is the 50-year-old attorney who had an underlying respiratory illness. And this is a respiratory disease, which makes the point that the target group, the vulnerable group, seniors, immune-compromised, underlying illness, especially an underlying respiratory illness. And even that individual who is hospitalized is in stable condition. So those are the facts of the situation. We're now in this daily mania, one case, new case, positive, negative. The more you test, the more positive cases you will find. So we are creating, we're in this cycle where we are actually creating knowledge of more positives because we are testing for more positives. If you went out today and tested for the normal flu, you would find thousands of people positive with the flu. We have 15,000 people in the hospital today with the flu. So perspective and context here is very, very important. Why are we working so hard to contain it? Because it is a dangerous situation, and if you are in that vulnerable position, in that category, it is problematic, and that's why we're doing everything we can. But again, context, perspective. I know we're all New Yorkers. I know we tend to get anxious. And I also know that people have received mixed messages on this. And I think that's part of the problem. Federal government says one thing, then you have this political debate. This one says it's underestimated. This one says it's overestimated. I think that has caused an uncertainty where people don't know what to believe. And that's why just the facts, ma'am, as they used to say. Just give me the facts, let me understand what I'm dealing with, and make an intelligent decision. And that's what we're trying to do. I thank very much our colleagues who are here today. Anyone who does believe they're in close contact is symptomatic, they should go to a healthcare professional. The county is going to notify the healthcare professionals that if they forward that person for testing, what facilities can do that testing, what hospital facilities can do that testing, and the healthcare professional has to contact those facilities prior to referring the person, because the healthcare facility also has to take certain precautions so that when the person comes in for the testing, they're not inadvertently exposing other people if, in fact, they do wind up testing positive. The county government has done a great job coordinating all of this. This is one of the more complicated situations that we've come across because of the number of interconnections that this family has presented. And the county has done just a great job. No surprise, because George Latimer is one of the really great ones, and he's been a colleague of mine for a long time. He abandoned me in Albany. He used to be in Albany. He fled Albany. I'm a little jealous, but he's doing a fantastic job, and I'm glad he's here. County Executive George Latimer.
Thank you very much, Governor. Thank you very much, Governor Cuomo, and we're very appreciative of you and your team interacting with our teams here in the county and in the local governments to provide us the manpower, the expertise, and the resources we need. We're particularly appreciative of your signing into law of $40 million appropriations, additional appropriations, with the support of the Assembly and the Senate, which will put financial resources there. Any of us who operate our governments under certain strict budgets realize that we're not going to make a financial decision as to what energy and effort we're going to put into this. Dr. Charlita Amla, who is here, who is our Commissioner of Public Health, is allocating resources to solve a problem, and the additional resources, financial resources that we can provide is very much appreciated. So thank you very much for that. I also want to thank Dr. Zucker, who has been, he and his team have been in close consultation with us. The county is tasked with implementing decisions that are made with the state and the county's cooperation. The state has superior authority to issue directives, and sometimes they will do that. Sometimes they'll leave that discretion to our basis. When it falls under our responsibilities, Dr. Amla, who is a pediatrician by profession, is well schooled in public health, and we have an operations team, all of it in this room, led by our Director of Operations, Joan McDonald, our Deputy Director of Operations, Emily Saltzman, who are doing a terrific job pulling those things together. But this is an issue that is evolving. And the governor said yesterday, and I think he was very accurate when he said this, we are in uncharted waters. From day to day, in any point in time, the day or night, we'll get a phone call, and it will change that dynamic for us, and we have to change with those dynamics. The Honorable Ben Boykin, who's the chairman of our legislature, and the members of our county legislature have been partners with us as much as possible in the decision-making process, and we appreciate that role. I will mention also that the mayor of New Rochelle, which is where this first active case and now multiple cases are based in, Mayor Noam Bramson, he and his team in the city of New Rochelle, which is our second largest city. I know when we talk about the city, we're always talking about that community just south of us. Here in Westchester County, we think in terms of Yonkers and White Plains and New Rochelle, Mount Vernon and Peekskill, and the mayor of New Rochelle has been a great partner with us. He's been with us as we've had our discussions, and we will continue to work closely with the municipal government. At our level, our local level, we realize this problem is not just confined to Westchester County. Some of the executives in both the healthcare and the education field around us have their operations outside of Westchester County, in the Bronx, in Manhattan. And so that is why the state's overview of this is critical. But our purposes of implementation involve us doing some very specific things. I will mention that for any Westchester resident that sees this and they have a general question, they can call the 211 number, easy to remember, 211, and that will get them general information. We contract with United Way of Westchester Putnam for that basic service. We have established a specific hotline for those individuals that are under self-quarantine triggered through this particular active series of cases, and that does revolve around those in the Young Israel of New Rochelle community that were involved in a couple of very specific events that the lead patient was at. And that number, and I'm sure we'll send it out through social media and through those of you in the media that cover Westchester alone, 866-588-0195. Dr. Amler's team, which includes experienced nurses. We also have mental health professionals at the ready. They'll be able to provide some electronic general information and then specific information, and we'll sure that that line, which I think will be operative a little bit later today, will be in place, and we'll try to help those people that will have innumerable questions, just as we had around the table when we were all together. Our Emergency Operations Center in Hawthorne is up and operative. It interfaces the county officials, the county entities with the state. It allows us that instant conversation that we have. And I will just end my comments by saying we are at a certain level of alert and activism. That level of alert and activism may rise. If it rises because of increased contagion or whatever the facts are on the ground, we will, in concert with the state and the CDC, we will respond to it. It is premature to jump to the highest level of alert and concern. It might be natural. I think the governor has made this point, very, very straightforwardly. It may be a natural tendency for us to move to the highest degree of concern. What if this and what if that? Those aren't illegitimate questions, but they're premature questions. Where we are today, we're well to focus on what we have to do right now, the detective work we have to do at the county level, interfacing with the state, and if situations change on the ground, those of us who are here, led by the medical professionals, will adjust our strategies and increase those strategies. But we need to understand, Governor said this, I'm just repeating it, there is a spread of a contagious virus. There's also the spread of misinformation and the spread of fear. And we may not be able to control what happens to a virus, but we can control that spread of misinformation and fear. And we must make an effort to do that in the age of social media, in the age of the internet and so forth. We do ourselves injustice by letting speculation run faster than facts and medical professionalism. So, Governor, thank you again for being with us and leading us through this crisis.
Thank you.